Oh my God, guys, $20? $20. If you want to know what I got $20 or what I paid $20 for here in Panama, stay tuned because that's coming up right after this. So everyone says living here in Panama, healthcare is cheap, but is it really? As a nurse living here, I want to share with you the real costs of doctor visits, labs, imaging, dental, and emergency care. And what surprised me the most, because the truth is, some things are very affordable and some things are not. So let's start with doctor visits. If you're using the private system, which most expats do, a primary care visit typically costs between $20 and $50. A specialist visit usually runs between $40 and $100. And here's what surprised me. You can often get an appointment within that same week. Many offices don't require referrals, and you usually pay at the visit. As a nurse, the speed and access here really stood out to me. Now, let's talk a little bit about lab work. Basic lab work usually costs between $20 and $40. More comprehensive labs run about $50 to $120, and results are often ready the same or the next day. Honestly, I've paid less here for full lab work than my copay alone in the United States. Next, imaging. This is where many people are surprised. An X-ray typically costs between $15 and $40. An ultrasound about $50 to $120, and a CT scan ranges from $300 to $700. An MRI usually runs between $400 and $900, and most of the time you can schedule those within days, not weeks or months. Okay, now let's talk about dental care, which this is one of the biggest savings here. A cleaning typically costs about $40 to $80. Fillings can range from $60 to $150. Crowns can run from $400 to $800, and a root canal about $300 to $700. This is why many people actually travel to Panama for dental work. And here's the reality part of everything: emergency and hospital care. An emergency room visit in a private hospital typically costs between $100 and $300. A hospital stay can range from $500 to $1,500 per night. So, yes, healthcare is more affordable, but you still need insurance or an emergency fund. Speaking of insurance, private health insurance for expats usually costs between $100 and $300 per month. I pay to 20. It depends on your age and the level of coverage that you're looking for. Many expats choose private insurance because the private hospitals here are modern and of a high quality. So here's what surprised me the most as a nurse. You often pay upfront, but the prices are transparent. Appointments are faster, and the quality in private facilities is excellent. So, if you're thinking about moving to Panama, healthcare costs are definitely lower than in the US, but it's important to understand the real numbers and plan ahead. If you have questions about healthcare in Panama, leave them in the comments section, and I'll be glad to answer them in a future video. If you're living abroad and you're planning a big move, please subscribe to Life Evolve with Michelle for real life health and wellness advice. Additionally, if you're planning a big move abroad and you're looking for someone to assist you with all of the steps that you need to from moving to your place to getting to the next place, I have partnered with, and they work with you to help. They work with expats to help get you situated in the new country. So if you're thinking about Panama, you're thinking about Costa Rica, Portugal, they help with all of those areas. So I will put their information in the link below. And there's also a discount code that comes with it. So if that's something you're thinking about, planning your move and you want some help, once you reach out to them, they would be an awesome help for you. So I want to thank you for joining. I hope you've enjoyed and you've learned something from this segment. I hope to see you on the next video and tune in. Don't forget to like, subscribe, and comment. Thank you.